Hi there. So, it's been a long time, right? Can you please remind me how to spell your last name? Yeah, that's what I thought. Thank you. So, any particular reason that you are here tonight? So, for your cranial nerve exam? Good. Are you taking any medications right now? No? Good. Are you allergic to anything or to any medications? Penicillin? So I'm gonna write that down. So, do you live at the same address like last time? You do. So it's 2233 North Elston, right? Good. So beside the medical questions, how do you feel? How is it going? Good. I'm happy that you are doing well. So let's begin your exam today, and I will start with the vital signs. So I'm going to put my gloves on, and I will start to check your heart first. Okay, so let's begin. Good, so I'm going to come very close to you right now. So you can close your eyes if you want and breathe normally right now. Good. Good. Now take a deep breath in, please. Exhale. Wonderful. Again. One more time, please. Good. One more time. Perfect. So I'm going to listen to your pulse now. Just relax and close your eyes. Good. So take a deep breath in now. Exhale and resist for a few seconds. Perfect. And we can do the same thing on the other side. So take a deep breath in, please. Exhale and take your breath for a few seconds. Okay, you can exhale. Okay, wonderful. So your heart rhythm is within the normal limits. I didn't hear just S1 and S2, no S3 or S4. So you are doing great so far. So I would like to take your oxygenation level. So this is going on your index finger. Good, so just stay like this for a few seconds. Perfect, so it's 98 percentile of room air and heart rate was 80. Wonderful. So next I'm going to take your temperature to make sure you don't have a fever. So I'm going to use this device and it's going inside the ears. Good. So I'm going to test this ear. So just wait a little bit. Let me see on this side as well. Okay, perfect. So it looks like you don't have a fever. I'm going to put this aside, and I'm going to write down your results from the vital signs. Good. So next I'm going to check your eyes. Did you have any problems or double vision or sensitivity to light? No? Good. So let's check then your eyes. So I'm gonna come a little bit closer. I'm gonna flash this light. So yeah, try not to blink and look at me. Perfect. So now just take a look at my nose and don't move your hand. Good. So I'm going to come very close to your eye now because I want to check your pupils to see how they look. Good. They are round and reactive to light. That's perfect. So I have this object now. So follow please the object. Good. That's wonderful. So looks like your vision is intact. You have a 20/20 vision, and next I'm going to check your face, your neck. I'm going to palpate, and I'm going to check your skin as well, and I'm also going to check inside your mouth. Do you have any soreness of your throat? You do? For how many days? For 2 days. Good. So I'm going to take a look inside. First, I'm going to come a little bit closer, and I'm going to touch your face right now and your neck. I'm going to palpate. Good. I'm going to check your forehead. Good. I'm going to palpate now your neck to check for any inflammation of the lymph nodes. So this one on the right, it's a little bit swollen, but otherwise everything looks good. So let me check inside your mouth. I'm going to use the tongue depressor because I want to see how your throat is looking. So I'm going to use this, and stick your tongue please and say ah. Perfect. Let me take a better look. So it's a little bit irritated, not so bad though. Good. You can relax now. So I didn't see any infection. It's a little bit red, but it's not so bad. So you can use some ginger, some teas, and some syrup over the counter if you want for any inflammation. It's not so bad. I think it will go away. So also let me check your teeth and your gums. I know they've been bleeding for a while, right? So let me see. So these are a little bit red. I don't see any cavities on the upper side so far. Let me see on the lower side. I don't see any cavities, but your gums are red, and you must see an orthodontist like me. Maybe you will need some braces for your teeth on the lower side. So I know it's a little bit scary, right, to get braces, but sooner or later you will need to. So good. So let me take some notes now. So eyes 20/20 vision, I didn't see any deficiencies. So mouth looks wonderful. Throat, it's a little bit swollen, not so bad though. Teeth, they are clean, no cavities, but you might see an orthodontist. And the gums are red and they're bleeding a little bit, so first you're gonna need to see the dentist. So I can schedule you an appointment if you want for next week. Good. Otherwise, everything looked good. So also let me check your your face. Face looks a little bit dry, though it's the season, but otherwise it's clean. Beautiful. So skin, it's dry. Perfect. So I'm going to do next the hot and cold test on your face. I want to see the how you perceive the stimulus. So I'm going to use this blue ice globe. I'm going to use it on your face and tell me if you feel this hot or cold. So I'm going to use it mostly on your cheeks. It's cold, yeah. So do you think this is cold? Yeah. Okay, I'll put it on your forehead. Good. Yeah, so this is called, your face is a little bit red here, but I think it will go away soon. Tell me, how do you feel this? Do you feel this sharp or dull? Do you think this is dull? Good. And tell me, how do you feel it now? The same, it's dull. Wonderful. And let me touch you with this. How do you feel this? Sharp. Perfect. No. Sharp. Wonderful. How do you feel this now? Sharp. Good. Now, dull. How about now? Dull. Perfect. What about now? Yes. How do you feel this? Dull. Wonderful. So I'm also going to use these sensory brushes on your face, on your shoulders, on your chest a little bit. So tell me please if you feel my touch. Do you feel this one? Yes, good. So try to tell me, where do you feel it? On your cheeks, on your forehead, where it's located, okay? You can close your eyes if you want. Perfect. Yes. Good job. Yes. Wonderful. Great. So let me write that down. So your face test sensations are, the results are very good. So everything looks awesome so far. I didn't see any problems also with your eyes. And I'm going to check also your taste and smell. And lastly, I'm going to check your ears as well. So let's begin with the smell test. Good. So I have a few tiny bottles, and I also have a few scents. So I will use 2 scents, and I will spray a little bit on the cotton pad. So just tell me, what do you think it is? What does this smell like? Do you think it's like fruits, like a forest? So like a forest? Actually it is. Good. So I'm going to use another scent. So you can smell. Smells wonderful. So this is mandarin and gingerbread, correct? Perfect. So I also have some tiny bottles, so please cover one of the nostril and try to smell through the other one. Wonderful. So this is apple, and I have another one right here. So try to cover now the other one and breathe. Yeah, so this is rose. Perfect. And I'm sure you will guess the last one. Yes, this is lavender. Wonderful. So looks like your smell it's intact. Good. So let's see now how is your taste. So I have something in this bottle, so please open your mouth. I will just spray a little bit. Try to identify it. It's very easy. I'm sure you will like it. And just say So yes, it's Sprite. Perfect. Good. So lastly, I'm going to check your ears to see inside your ears, and I also am going to do a hearing test. So I'm going to come very close to your ear and try to visualize the tympan membrane. So it's a little bit difficult here because you have some wax built up. So let's see on the other side. So here it's a little bit better, but you still have some wax. So I'm going to use some Q-tips for your ears. I'm going to try to clean a little bit to see if you feel better. So I'm going to come closer to your ear and good. I'm going to use another one right here. So let me take a look. Perfect. Okay, and I'm going to clean also on this side. You have just a little bit here, you have more on the other side. Yeah. Good. Perfect. So I'm going to use some acupressure on your ear right now. This will help you relax. So I'm going to use it right here. Just try to close your eyes and relax. So I'm going to use the acupressure on the other side as well. Just a little bit more. Okay. So let's see how is your hearing? You still have a little bit of wax here, but I didn't want to use the Q-tip very deep to make sure everything is fine. So let's see how is your hearing. So tell me if you hear this. Yes, you do? Perfect. So tell me when it stops. No? Perfect. Tell me when it stops. Wonderful. And tell me, I'm going to put this very close to your ear, and tell me which one is louder, position number 1 or position number 2. So this is number 1 and this is number 2. So number 1, perfect. So this is number 1 and this is number 2. Number 1. Wonderful. So I'm also going to tap on your face to make sure I'm not missing anything. So you can still close your eyes and relax. Okay, good job. So just let me check your sinuses to make sure everything is fine. Any pain when I'm touching? No? Okay, what about here? Where is your nose? No, everything is good. All right. Good. So everything looks wonderful on your face. It's symmetric, round, very nice color of your skin. It's a little bit dry, but it's the season, so I'm not so worried about it. Good. So let's continue with the other test now. Let me write down these notes. I hope you relax and stay with me for a few more minutes until we are done. You are doing great so far. So maybe another 10 minutes, stay with me. Good. Do you have any questions in the meantime? No? Great. So let's continue. I also want to check your head a little bit, to check your scalp as well, and to check for any infestation, if you don't mind. So I'm gonna use this to check your hair a little bit, and I also see how is your scalp. I know you said it's a little bit itchy, right? So I want to make sure you don't have any infestation or some irritation. Good. So let's see this side. This one looks good. I don't see any redness. And this is clean. I don't see any dandruff as well. So let's use it on the other side. It's clean, and I'm going to check here. Where are your ears? Behind the ears. Yes. So I'm going to check on the other side, behind the ears. Yeah, so let's see. That's wonderful. Let me take a closer look. Yeah, no infestation. Everything looks perfect, and now I will put my fingers like this, and I'm going to feel if you have any bumps or lumps. So just relax, and you can close your eyes if you want. Let's see behind your neck. Okay, on top. Good. Okay, so I'm going to use this brush, and I will try to give you a little bit of scalp massage. So just close your eyes and relax. Good. So I'm going to use it now on the side a little bit. Just relax and close your eyes. Okay, that's very good. So, scalp looks wonderful. I didn't see any redness. That's awesome. No dandruff. So now I'm about to finish the cranial nerve exam for today, and I want you to do and to have one more test. So I'm going to say something, and you need to finish the sentence to say like the last word. It's not complicated, it's very easy. We'll see. So let's see. You can close your eyes if you want, and we'll begin. So 1, 2, 3, 4. What's next? 5. Good job. So close your eyes now, please. 5, 4, 3, 2, 1. What's next? 0. Awesome. And let's see one more time. 20, 21, 23, 24, 25, 26. Good job. And let's see. 10, 9, 8, 7, 6, 5. Good job. Perfect. So I'm done with the cranial nerve exam for today, and I didn't find anything abnormal. Everything is perfect. You look very good, and I just want to say that thank you so much for participating, and I hope to see you soon. Take care. Bye.